Close to 11,000 British Columbians signed a petition to repeal the province's Health Professions and Occupation Act called Bill 36 on Wednesday. And today I bring you an interview with the member of the Legislative Assembly who brought the petition forward, and a vascular surgeon with over 30 years' experience who says the bill isn't just a disservice to medical professionals, but also to their patients.
With Bill 36, at the heart of the matter is that instead of providing individual patient care, going above and beyond, trying things that are outside of a guideline, the government instead is going to introduce politics into medicine and tell doctors exactly how they're going to practice.
This is a bill that, because it fundamentally changes how the healthcare colleges are governed in the province of British Columbia, there should have been a much more in-depth engagement with the healthcare professionals about those changes.
Drea Humphrey here with Rebel News, and I brought you many reports on British Columbia's understaffed and overburdened healthcare system. While the NDP government claims to be doing everything they can to fix it, they stubbornly refuse to take back their thousands of unjabbed healthcare workers to address the situation immediately and without spending tons of money. I've also reported on how during a time when the medical professionals who are still allowed to care for patients in British Columbia are at an all-time high with burnout rates, the province was busy working at passing Bill 36, which is adding more stress to many of the medical professionals who are starting to learn more about it. The bill is expected to drastically change how medical professionals are regulated in the province, and those concerned about this say it will open up the floodgates to politicizing the industry altogether and punishing medical professionals who dare to speak out against what that means for their patients. Growing concerns about the bill have gotten so bad that two activists have actually recruited over 200 canvassers to inform the public about the bill in Premier David Eby's Vancouver Point Grey MLA riding. They're also doing so in hopes of gaining enough signatures to effectively recall David Eby's new MLA seat from him for his leadership during the passing of the bill. You can find out more about that Recall David Eby campaign by clicking on the description box below and then clicking on the link for the written article for this report. But for now, let's take a deep look into why so many people think this bill is problematic, not just for medical professionals, but for patients alike. You're about to hear from Nechako Lake's independent MLA, John Rustad, who proudly introduced the petition, which, by the way, is one of the largest petitions the legislature has ever seen in this province. The petition seeking for the province to reconsider Bill 36 was signed by well over 10,000 allied healthcare professionals and concerned citizens like Dr. York Shung, who you're about to meet in a moment, and here is why.
Across British Columbia, we are facing a healthcare crisis. There are emergency rooms closed. There are, almost 1 million people without a family doctor. The wait lists are unbelievably, and the wait times are unbelievably long. And people are very concerned about healthcare. So what Bill 36 does, it was a bill that was passed by government this past fall, and it changes the health professions and actually takes governance away from the health professionals and puts it in the hands of government. And there's a lot of people that are very upset about this because they are concerned about their own personal health records. They're concerned about the independence of their doctors being able to speak out, provide them with advice. They're concerned about mandates that may come in and end up being part of this. So has been a movement by doctors and nurses through the allied healthcare workers to try to repeal this bill. And so a petition has gone out around the province. I'm so pleased that I was able to work with them and bring forward a petition that has 10,845 signatures, which is a very large petition for the legislature.
Now, that does seem like a large petition. Tell us what the normal response is to petitions, whether it be of similar nature or at least in this province. And can people still sign this petition now that it's been brought forward?
Yeah, so normally when a petition comes forward, you get hundreds of names. Maybe you get a few thousand names if you're lucky. There's been one, I think, that's had 35,000 names. But, this is one of the larger ones that I've seen come into the legislature. But I got notes from hundreds of people around the province that still want to collect names for this petition. And many have just found out about it a week or two before we kind of had the deadline. And we set a deadline because we needed to be able to bring it forward and wanted to get it in at the beginning of the session. So we're encouraging people to still collect names, to still collect signatures. And, if we have another batch that we're able to introduce in the legislature, we'll do that at a later date.
Now, I've covered a lot of the concerns from healthcare workers about this bill, and it's nice to see you bringing this petition forward. But tell us a little bit about when it was being discussed. Some say that it was rushed, some say it wasn't. I believe it had over 600 pages. So what can you tell us about when it was being voted on?
So there's about 645 sections to this bill that came forward. As it was actually developed and brought forward as a collaborative effort. There was a group of people that consisted of the NDP, the BC Liberals, the Green Party, as well as people from the healthcare profession in terms of the colleges. However, all of them had to sign non-disclosure agreements, so nobody actually got to talk to the doctors and nurses really right around the province. So many of the doctors and nurses don't know that this bill is even being put in place. And that's pretty, concerning considering what the impact is. And of course, when a bill of this size comes into the legislature, there are games that are sometimes played by opposition to drag it out and make sure the government has to force closure. And so, unfortunately, because of these games that went on, a lot of the sections of this bill did not get debated. And so it was something that then was used closure, brought forward. But at the end of the day, this is a bill that, because it fundamentally changes how the healthcare colleges are governed in the province of British Columbia, there should have been a much more in-depth engagement with the healthcare professionals about those changes. Because ultimately, I believe that the professionals, the healthcare professionals in particular, but all professionals should have the ability for a college to be governed by their peers, to be able to bring forward and to be engaged that way.
Well, I think you're right on that too. And we also interviewed one of the doctors who have also been involved in this report. Is there any last words you want to say about this bill, or anything that you think should be done to sort of address our healthcare system as a whole right now and how it is managed?
You've asked a question that I could go on for half an hour on in terms of the healthcare. There's so many changes that we need. I'll limit it to the bill. The hope is, from a petition like this and from efforts that other people have, that government will pause. The petition itself, or the bill itself, was passed last fall. However, it's not enacted yet. There's still regulations that need to be built, and then it gets enacted through an order in council, which is a process that's done by cabinet. So there is a window here for government to pause and actually do this broad engagement, to get the input and make changes, or just throw it out and bring forward something that makes more sense. And that's what this petition is about. It's about trying to put the pressure on government to get them to say, wait a second, maybe we should take a path that is more collaborative, that is more inclusive of the healthcare professionals. And it's part of a theme, I think, in terms of general healthcare in the province. There needs to be more respect for our healthcare workers. There's tons of respect by the public, and our healthcare workers are doing phenomenal work, but they are incredibly stressed. They are understaffed. There's over 6,000 healthcare workers that have left the system because of mandates. And I just, we should really start thinking more about putting patients back at the center of healthcare and how we work through our healthcare system to be able to improve it for patients.
Well, there you have it, MLA John Rustad, Nechako Lakes. I'll put his information as well as the petition in the written box below. There's a link there to the full written report. This is Rebel News, and thanks for coming to join us today.
Thanks so much, Dre.
It will interfere with the relationship between the doctor and the patient on a very basic level. And so I can comment on both how it will impact the physician, but I think also it'll impact the patient. Let me give you an example by what I mean. For those British Columbians who are fortunate enough to have a family doctor, the next question is, how do you know that you have a good family doctor? What makes a good family doctor? Well, I think that a good family doctor is the one who cares about you,
right?
Who knows about you, who knows your family. He knows or she knows your personal circumstances, your likes, dislikes, knows your allergies. And that doctor is going to fight for you, is going to advocate for you. A good family doctor will chase down investigations, for instance, a biopsy result. And so I've heard horrible stories about these biopsy results that get sent, get filed away, and are not acted upon. A family doctor is very, very conscientious about that. A good family doctor does not follow a guideline, which is just suggestions. A good doctor offers you personalized health care. So from the physician's point of view, I want to be able to provide that personalized health care for my patient.
Right.
I know my patient is very important. I know they have a family, they have friends, and I'm going to do my best to help them. With Bill 36, at the heart of the matter is that instead of providing individual patient care, going above and beyond, trying things that are outside of a guideline, the government instead is going to introduce politics into medicine and tell doctors exactly how they're going to practice. And if the doctors practice differently outside of those guidelines, they will be sought, identified, and there will be tribunals set up if you practice outside of the guideline or if you speak out against the guidelines or against the government. There are punitive measures of removing your license. There are measures suggested as imposing very stiff fines, despite for more serious crimes, there's a kind of like a catch and release system where people are generally very light on crime, but they're going to go after the doctors or speaking out or actually advocating for their patient, and incarceration. So my concern is that why would you introduce such a drastic change at a time when the BC healthcare system is in entire crisis situation? What we lack is that we not only lack funds to look after our healthcare system, we have institutions which aren't able to provide necessary tests, operating rooms, operating time. We don't have the personnel either. Bill 36, my concern is that it's going to drive away healthcare professionals. I'm not talking about just doctors and nurses, because Bill 36 goes after any healthcare professional. That's your chiropractor, your traditional Chinese medicine doctor, your physio, your occupational therapist, your denturist. They're going to collapse all of those 15 colleges into 6 and control them all with an additional layer of bureaucracy. So you have a situation where you don't have enough healthcare workers. This bill is going to drive healthcare workers away. It does nothing to retain them. It doesn't do much to attract them, because a healthcare worker, there is talk at the Canadian level that they're going to have a pan-licensure agreement so that any qualified Canadian doctor can work in any province. Why would any Canadian graduate want to come to BC once they know that Bill 36 is here?
With all that pressure.
Right. No other provinces for now have a similar Bill 36. Perhaps it may come, but for now, that doesn't apply. So why would any graduate really want to come here with that hanging over them? It's just overall, I don't see anything positive in it. And I think that the way that the government introduced it in the last week of November before the winter break, and they rushed through it so quickly without full debate of the whole bill, and they just invoked closure and they wanted a vote, and since they had the majority, they could pass it. Why were they in such a rush? It's such an important bill that will affect every British Columbian.
Real quickly, last time we had you on Rebel News, we talked about your society's challenge, a judicial hearing that you guys are working on with some of the COVID policies in your industry that are also hurting the healthcare system in British Columbia. Give us a quick update on that.
Well, thank you very much for allowing me to speak on that. It's surprising that most people are not aware that the unvaccinated healthcare workers are still not able to return to work, yet they're allowing the vaccinated healthcare workers to, in fact, work sick. And so we have challenged the government's position on this, requesting that a justice reviews the reasonableness of the government's position, stating that there is still this emergency situation and that unvaccinated healthcare workers still pose a risk to patients as well as staff. I do not think that there is any literature to support their position. So there was a case management conference in early December last year, and so that the justice can be made aware of our situation and the government's position. And we are waiting for the justice to release his decision as to what needs to be in the government's record. In other words, what is the scientific evidence that the government had at the time that said that unvaccinated healthcare workers could not work, and continues to this day. And so we have a crisis in our healthcare system. We have very able and willing to work healthcare workers sidelined. It makes no sense whatsoever.
Well, I look forward to doing an update for people on that. And yes, show us the science. Absolutely. Again, the petition as well as your society site. I know you guys are crowdfunding as well. So I'll link all of that in the written article in the description box below. Thanks for being on Rebel News, Doctor.
Much appreciated. Thanks, Drea.
If you appreciate that Rebel News is quick to bring you the other side of the story to state-backed media to keep you informed, including on risks to our healthcare system, then consider supporting our journalism, which is completely independent of government interests. You can do so by going to rebelnews.com and clicking on Donate. We appreciate your support.